Hello, wonderful people. My name is Miriam Uduack Mensah. It's a wonderful time I'm going to be spending with you here. So stay right here with me. We're going to have a wonderful conversations. If you're Ghanaian, if you're African, if you're Nigerian, you're South African, you're Kenyan, get in here. We're about to have a conversation today. We're talking AU Day special, African Liberation Day special discussion. And again, my name is Miriam Uduack Mensah. When we delve deep into this conversation, you realize that there's so many things there's so many codes we haven't broken as Africans, and this is why this conversation is important. Now, today we explore a question that sits at the heart of Africa's future. What should African sovereignty mean today? Is sovereignty simply about political independence and territorial control? Or does it now extend to economic self-reliance, digital ownership, resource management, and the ability to shape our own development? Now, of course, when the agenda is to build our own economy, you are wondering whether we're at an intersection where we don't understand what we're doing, or we don't have the leaders to drive this conversation. As Africa navigates global partnerships, technological transformation, security challenges, and economic integration through initiatives like the AFCFTA, we ask, what does true sovereignty look like in the 21st century? And how can African nations strengthen it? Join us as we unpack this very huge conversation in 1 hour. My panelists, they're ready. They said to me earlier, you're actually losing us out for this conversation. Yeah. I pray they're not so loose to make it look like we're going to have it on the light level, because that's not what we're doing over here. I have Ayesha, Imam.
Hi, how are you?
How are you doing?
I'm good, thanks.
No, I love the hair. I want to look like you when I grow. And I do have, and she is from Nigeria. Pamela Takyiwaa is Ghana.
Hello.
Am I representing you well?
Yes, thank you.
Yeah, because I don't know whether I want to be Nigerian today or Ghanaian.
Nigeria never carries last.
I was going to say, looking at my left and right, today I might be Nigerian.
Yes.
Just for the purpose of this conversation.
It would be safe. I was just about joining you. Because my middle name is Uduack. That's a Nigerian name. I don't know if you realize that.
It's very Nigerian, yes.
All right. We have Moses Mulumba.
So happy.
Please, let's feel the energy of the only man in the room. Because already majority is winning. All right, and we have Fadekemi. I pronounced that well. Made Mama proud?
You did do
That's
we
right.
won't take your card back.
Yes, please. Yes, please. Well, I'm going to be introducing to you our guest for today, Ayesha Imam. Dr. Ayesha Imam is a Nigerian feminist scholar, human rights advocate, and researcher whose work has shaped major conversations around gender justice, democracy, development, and women's rights across Africa for decades. She was a founding organizer of Women in Nigeria, that's WIN, one of Nigeria's earliest feminist organizations, and has worked extensively with global and African institutions on gender, human rights, democracy, and sustainable development. This is what you shout. And then I have Pamela Takyiwaa all the way from Ghana.
Listen, very far away.
Very far away.
It took me some time to get here.
Pamela Takyiwaa is a Ghanaian creative strategies, event curator, and reproductive rights advocate whose work sits at the intersection of creativity, social impact, women's leadership, and community engagement through platforms such as Jane Can Do Creative and Tech Expo and hashtag We Are Boss Open Mic. I pronounced that well. Yeah. She has helped create spaces for innovation, storytelling, and youth empowerment. Ladies and gentlemen, Pamela Takyiwaa is also joining us today. And Moses Mulumba, the only man in the room. Dr. Moses Mulumba is a Ugandan lawyer, global health advocate, and human rights expert, specializing in health justice, sexual reproductive health rights, and international human rights law. He is the Director General of Afiani.
Health and Justice.
Yeah. And founding Executive Director of SIHARD. Got that?
Yeah.
Okay. And has led major legal and policy interventions, advancing health equity and social justice across Africa. Ladies and gentlemen, the very bold man who sits in between women, because this one is you're very, very bold, oh. You're very, 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 because this women you're sitting with, powerful women. Well, last but definitely not the least, Fadekemi Akinfaderin is a Nigerian feminist advocate, communication strategist, and storyteller whose work focuses on gender justice, bodily autonomy, movement building, and digital advocacy across Africa through her work with Force Feminista and broader feminist organizing spaces. She has contributed to major public conversations around reproductive justice, feminist leadership, youth advocacy, and the role of storytelling in social transformation. Ladies and gentlemen, Kemi. Yes, 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 yes. Now, I was going to start the conversation on a very different note, but I can help it. When I hear feminists, I always say, Mama got it, she contributed. When I hear feminists, we see what is happening on social media now. But then again, I think I try to throw a bit of light on feminism and the movement and what it was supposed to be. Today, I'm glad that we have feminists from back in the day who understood truly what it meant to be a feminist. Can you break it down for us, Mama? How the journey of becoming a feminist was like back in the day?
It's actually quite simple.
Yeah.
If you recognize that women have been subordinated or exploited or discriminated against, and you want to do something about it, you're a feminist.
Okay.
That's the simplest
This is
version.
simplest.
But we have since then been working on what does it mean to be an African feminist? Because when you started working, we would always get, oh, no, this is a Western idea.
Yes.
No, it's not a Western idea. So we look back in our history. Have we seen women fighting pre-colonially for women's rights? Yes, we have. So it's not a Western idea. Thank you very much. It's an African idea, and we shall continue building on that history. But secondly, as African women, or the majority of African women, don't only have problems as a gender group, which we do have, gender-based violence, discrimination against women. We also have problems because we're Africans in a continent that was colonized and is now subject to neocolonialism. And we also have problems because even within Africa, both pre-colonially and post-colonially, there were groups that were elites who exploited poor people, whether they're rural or urban, and all of those have to be taken together. Not one of them is no more important than the other. Because as a human being, we have multiple facets of identity. So if we want to have all people do well, we have to look at all the relationships that marginalize people or exploit them or make them feel bad and deal with all of them together. And that's what we call African feminism.
African feminism. And have you ever heard of the term modern feminism?
Heard of it, but it's whatever the particular age you're in now is modern.
Yeah.
So what was modern 50 years ago is not the same as what it is today.
So you accept it? Because modern feminism paints a picture of men haters.
No, that's inaccurate even of women in the West.
Yes.
Never mind African women. African women have always said men are also implicated in gender relations.
Right.
Because of the lived experience that women have, there are certain things on which women have to lead in women's liberation.
Right.
But women need to work with men, or more to the point, men need to work with women to address gender equality, racial equality, sovereignty and freedom from neocolonial relations. So
I guess whatever your idea of feminism is, let us stay in your room. I promise you, you're going to win. All right. I'm going to stay with Ayesha. For many Africans, political independence. So we're focusing on the topic for today, and I'm going to start with because again, like I said, that one was just in passing.
Preliminary.
For many Africans, political independence did not automatically translate into freedom in everyday life. So from your perspective, what does meaningful sovereignty actually look like for ordinary people today?
Well, I'm going to start with, economic sovereignty, because when we started with flag independence, what was then called development was a big thing. But in economic sovereignty, we find that instead of being able to husband and resource and control our resources for our benefit, they have been taken out. Right now, we are losing more than $100 billion in potential revenue. Despite 60 years of post-colonialism, we are still net creditors to the world, meaning they get more out of Africa than we get back from the world. So the first thing, if we had meaningful sovereignty, would be we would have more within Africa to be used for the benefits of Africans. The second thing, meaningful sovereignty, is that that benefit would be more evenly distributed. It wouldn't be the very wealthy up here and the huge 90% of people down here with very, very little. And it would mean, at a minimum, that we would have to stop talking about gross domestic product as the indicator of development. Because we know in Africa and lots of other places in the world, gross domestic product can go up, while at the same time, people's real living income, poverty is rising and spreading. So it's not good enough to measure it. Even to talk about per capita, which is dividing the gross domestic product by the number of the population, is not a good enough measure. What we need to use as a measure is modal per capita, which means this gross domestic product, the largest group of people, what is their income? So if we find that the income of the largest group of people is still very low, which right now it is, then we know we don't have meaningful economic sovereignty. In the realm of production, of mind, if we had intellectual and education sovereignty, we would no longer have, as my colleagues were telling me earlier today, a question in primary school that says, what are the 3 benefits of colonialism? Excuse me? The benefits of colonialism that took us out of history, that exploited us, that made us subordinate in world relations? How can we be teaching our children and require them to say,
I'm sure I've seen
there
this
are
question
benefits?
before.
Yes, it's Ghanaian schools.
I have seen this question before. Yes.
We would not be having that. We would be having questions that ask us, what does African history tell us? The good things and the bad things. So it would be asking us, what do we need to live good and productive lives? What do we need to be able to look after and care for each other? That's the kind of intellectual and productive things we need our schools to be doing, not to be valorizing exploitation of us, really. So if we had meaningful sovereignty, we would have a concern for gender justice. We would have policies in the state that instead of retracting state responsibility for the provision of health services and education services, would be making sure that they are accessible, preferably free, because that kind of policy serves the interests of women who very often are not going for health services unless it has to do with their children, serves the interests of children, serves the interests of poor people, okay? Meaningful sovereignty would necessarily do that for education, for health services. It would mean also that popular sovereignty, meaning the state, the government, the elites, would be held accountable for when they are not doing their primary duty of protecting and promoting.
It's interesting that you bring that up, because over here in Ghana right now, we're discussing public officials being given awards. So I just had to throw that in. I'm sorry. I had to.
Best Minister of the Year.
Best Minister of
I
the
don't know
Year.
what that means.
Well, how high is the bar? Do you have very good ministers with very good policies?
As a Nigerian, I don't know if I can answer that question. But as a Ghanaian, sometimes.
That was a quick switch. No, Ayesha doesn't like this. Ayesha doesn't like this, please.
But as a Ghanaian, I would say the bar is in hell. I'm sorry for using bad language.
We're getting out of...
Talking of Pan-Africanism, I'm a Nigerian who's married to a Ghanaian.
Let's talk about this though. This one. So which means that you can play both.
Yes, yes.
What do you think?
Multifaceted individuals, identity. No, that's why I deferred to you.
The bar really, I think when back to your question on the awards and what it means for sovereignty, for me, it's almost as if we are not willing to hold people accountable.
So, because you know that's where this conversation is coming from, accountability.
Yes.
At what points do we have, and it's really fascinating how they themselves can adjudge themselves most, best performing. However, when it comes to public service, then the conversation gets different. So again, a lot of people are really excited about the stance of the president of Ghana.
To cancel it completely?
But we'll go to the awards at the end of the show, I promise. These awards, we need to discuss it.
No problem.
The other question is, what are the criteria and who makes the judgment? Who decides?
Still waiting. So even the organizers couldn't even break that down for
It has
those
to be people. If they were going to do this, why not just focus on the people, judging them on how they're delivering
who is selecting these people
well,
for awards?
you can crowdsource it. You can crowdsource average Ghanaians to rate the performance of public servants.
In the spirit of accountability, and still on the topic of accountability,
Yeah.
it is just sad, and I'm going to borrow your words, sad, because in a different setting, without you in the room, I would have said something else. It's sad that even these individuals who brought themselves up to render service to the Ghanaian people, even deemed it fit to show up for these events. It's just heartbreaking that even they know that they don't deserve these accolades, but they will still show up anyway.
I believe on the day of the awards, there was a flood. Was it the day after
Yeah,
or the
there
day
was.
before?
And
There was a
Beza
fire
judge,
outbreak. There was a couple of people
Takyiwaa
lost their
will put us
homes.
into trouble at this point. Let me stay
That's
with
a
you.
Nigerian. Again, just clarify. But yeah, so even on the question of who gets to vote for them, it brings back the question of why should we vote for you as a public service servant on if you're doing your job well or not? You volunteered for the job.
And
You
shouldn't your work be
decided that
speaking
you were
for you?
capable of doing the job. We should judge you based on the work that you're doing. So if by the fruit of your labor, we are saying you don't deserve the award, why do you get angry and say you deserve the award and people are unappreciative? Which is also very odd coming from a public servant. What are we appreciating? You came for the job.
I think there has to
And
be
you're
a
not
whole.
doing it for free, by the way.
Thank you.
I think there has to be a whole education on this public servant's role. There has to be. There has to be. I think the Westerners catch the drift. We're still struggling with it.
We'll see.
You don't know. You don't know about that.
I have recently been in the USA.
Yeah.
Westerners catching the gist about public service.
No.
Yeah, no, sure.
Look at the current president, who is doing things so awful that even his own people are beginning to desert him. No,
So no, they
please.
don't. They don't either. The world is in shambles. Well, a lot of Acadians, essentially, I'm coming to you.
Yes.
A lot of Africans today are reimagining identity work, creativity and leadership. Of course, they're imagining that differently from previous generations. What role do culture and creative spaces play in shaping freer futures?
First, I want to say that identities aren't formed by themselves. They are not formed in small rooms. It's based on your environment, the people around you, what is reinforced and what gets affirmed for you on a daily basis. That's how we form our identity, right? So when you look around you and you look at the culture that is readily available, as a young person, you have to decide for yourself. Like Doc said, this is your modern reality right now. Does this work for you? And I find, at least in my work with Ghanaian creatives, African creatives, that we are rejecting that identity. For us, being African is being Pan-African. And so our work right now feels more interconnected. My work sits with Nigeria. My work sits with Kenyans. I work with Sierra Leoneans. I don't work in a vacuum, even in my creative work, because we are rejecting the idea that to be African is to be just one identity. We are rejecting the idea that being Ghanaian and wearing your jersey and shouting it out loud is not sufficient to build your identity on, right? Because our struggle is connected. So we are building on the legacies of very important people like the people around me and saying we are ready for a new reality. We are imagining a world where this is not the end of the world for us. We're imagining a world where you are able to go to Nigeria without having to pay $800, right? And we are actively building that world for ourselves. So that's a very heavy loaded question. I just want to say that, again, we are building on things that have already been, our identities are grounded in Pan-Africanism. It's grounded in the reality that what we have now, neocolonialism, will not save us. So we are rejecting all that and building a completely different reality for ourselves, right? So yeah, I'm excited.
And it's actually very interesting that you say this, because this is an idea a lot of young Africans probably are moved by, and then there's a very small group. I want to promise you, we're doing a great job. This generation, we're doing a great job. Very small group of Africans are not, accepting this, that we are to work together, not in silos. And to get to the Africa that you don't want to pay $800 to move around, we cannot work in silos to achieve that. We're not there, honestly. If I look at it from where I sit as a young person, I think that we're actually contributing to that never happening. And that's what what is happening in South Africa.
Well, I think I'm going to let Dr. Moses speak, because
Okay,
I feel
then let me go to Dr.
I think that at least my education with Afi and Haki just focused on advocacy work itself
Right.
alone. It wasn't just me in the class. There were multiple people from other countries in the class. And all of us had one common goal, that we believe that we all deserve reproductive rights and we are willing to work towards it, right? Or even if I look at the work that Kemi is doing with Force Feministas, it's not in a silo. Movement building has never been in silos. It just appears that way if you are on the outside. And I think today, earlier, we spoke about how we can include more people and how we can communicate the work that we are doing. Because we are building really deep, well-connected movements. Like, we are not working in silos.
Okay.
I don't work in silos. I am privileged to work with African feminists from different parts. So I think maybe our problem or our challenge is that we're not communicating these wins as well as the losses, but we're not working in silos.
Thank you for debunking that, because I have sat on my platform and I've made noise.
No.
That you people, I am not your stereotypical young African advocating for. I'm not. You will probably not see me in any demonstration. But really and truly, when you look at the things I talk about, when you see me criticizing leadership, you know that I want Africa to work. So I don't. There are probably people like me who probably have the platform, and so when I look at platforms like that and I don't see what I want to see when it comes to advocacy, then I guess I have a problem. I am a contributor to the problem. But let's not focus on me too much today and what I am not doing. I'm going to come back to the only man in the room. Let me say that, because sometimes when you meet women in the room, you say, oh, she's the only woman. Let's do it to you. See how it feels. Africa continues to depend heavily on imported medicines, donor funding, and foreign pharmaceutical systems. What does true health sovereignty actually look like for African countries today? How do you think the Ugandan sovereignty bill would affect fellow African countries? Doc, over to you.
Thank you so much. That's a loaded question.
Right?
I come from Uganda, and two things have happened, and you've highlighted them. First, we passed the sovereignty bill, protection of sovereignty bill. But then second, we are dealing with Ebola as a country. So two fascinating things. Those two things I think are fascinating. First, when it comes to sovereignty, I think Ebola demonstrates the practical definition of sovereignty. While literally in English, you may think sovereignty is about being independent, I think the whole world is panicking about Ebola. So they can't be independent of us, and neither can we be independent as Africans, it's something that's much more. I have seen every person closing the borders. Uganda, you can't cross to the US, you can't go to Canada, and a few days ago you can't go to the UAE. I've just seen a news clip that in China they are hunting down all the Ugandans that have entered. So certainly we can't keep running away from facts, and we need to redefine what sovereignty is in a global world. It brings to many things. We can talk about access to medicines, which is a historical problem, but where we are now, we are talking about a new condition with a variety that cannot be tested, that you can't immunize, you can't have vaccination over, and certainly everyone has to be concerned that as a global world, we need to revisit the injustices that have led African countries in many ways not to be able to have pharmaceutical production the way it was. Very historically, the colonial times, we criminalized African production of medicines. Everywhere you went, in Uganda, where I come from, there were villages that were gazetted as sources of African medicine. We got laws that criminalized that. When we had COVID-19, we had set an international standard. Even when a Ugandan came up with Covidex, which eventually became the most popular used interventions and relief, it could not pass the international standard. So there are international standards all over us. There are international expectations all over us. And it becomes very difficult for us to say that we are therefore sovereign. Now, when you look at the Ugandan bill, it has also demonstrated something for Africa and the definition of sovereignty. Sovereignty has never been for governments. You can't talk about sovereign governments. Sovereignty is for people. In fact, the governments hold the principle of sovereignty in trust for the people. Unfortunately, when you look at the Ugandan legislation, we have legislated sovereignty for the government to entrench itself in power and do away with all civic movements and resources which are coming to support civic people. So in a way, the government is actually claiming sovereignty while suppressing the civil rights of the people. So the concept of sovereignty in Africa has to be understood from a point of we are not replacing poor leadership, old leadership, as Kwame Nkrumah was saying. You can't replace poor leadership with new leadership that is equally poor. Yeah. What we are looking for is new leadership that is transformative, that helps African people to understand what sovereignty is. So all these challenges we have, the intellectual property that has been put on medicines that we can't access as Africans, continues to demonstrate that sovereignty is being tied to international norms and international standards. And I think as Africans, it is really time that we strengthen our own standards and norms, which benefit our people, rather than African leaders spending a lot of time entrenching themselves in power and empowering themselves much more than the people that they are leading on behalf of. Yeah, so I think really the current situations on Ebola, the current situations on these laws that are being passed are really a good example on how Africans need to look at sovereignty differently.
Differently, indeed. You want to add something?
Yeah, I was saying earlier that part of meaningful sovereignty would be precisely providing free and accessible health services, including on Ebola. But there is also, apart from being constrained by the so-called international, meaning Western standards and decisions about what is to be trademarked, what is to be under patent, and what therefore we cannot make because somebody's taken out a patent, even if we grew it and it's an indigenous plant. Okay, but there is also work that we need to do internally to hold our state and our governments accountable, so that when they're doing budget provisions, they're providing for health services rather than presidential palaces. They're providing travel for poor people to get to health services rather than a multiple trip in 5-star hotels to Europe or to America, for example. Yeah? So that work we also need to do, because we are having resources extracted, but we still do have resources that we need to allocate better.
Indeed. Indeed.
But also basic, just a minute,
Yeah.
just basic things like redefining values. We have actually seen that the international community is trying to help Africa define values. And our first ladies have gone on to define what family values are based on evangelicals that have flown in from the US and all over to educate to us what values are. I think that's where part of the problem is. There have been very good traditional understandings of values, and which I call positive narratives on the African continent. Very positive narratives that are watered down on international definitions of things like values. That's not sovereignty. And yet, the highest offices, the presidential offices, the first lady's offices are actually advancing the agenda on the redefinition of values, family values, based on Western understanding, in total disregard of what Africans understand as values from the past.
We're supposed to be clapping.
We needed a little audio at the back. Woo, 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 woo.
Kemi has been quiet for a bit.
Have.
Listening and enjoying is the conversation. Well, I'm coming to you, Kemi.
Yeah.
When we talk about African health sovereignty today, what are some of the biggest structural issues shaping healthcare access, reproductive justice, and bodily autonomy across the continent?
No, I'm so happy you asked me that question.
Yeah?
Because Ghana
Yes.
and the current president
Yeah.
has taken this on
Yeah.
as his mantra for his administration on a global level.
Right.
So I'm sure many people have heard of the Accra Reset, and this is like a new agenda
Yeah, it is.
that President Mahama has taken on to be able to position the sovereignty of African nations in terms of our ability to do everything you were asking Moses about. Our ability to be able to set our own agenda when it comes to our health, our ability to be able to have one plan, like one strategic plan for the
Agenda.
health sector, one agenda.
National agenda.
Exactly. To be able to have one budget. So meaning that any sort of support and investments that's being made in the country must go to the government through one budget. And then, of course, the third pillar, which is basically one system, one data system, in terms of thinking about how we're reporting, it needs to be able to be owned and be able to be hosted by the countries itself.
Yes.
But this is not in response to us thinking through what Africans want. It's in response to the United States eliminating its funding for global health. So we decided to posture now and come up with this framework in response to reduction in resourcing. USAID, the elimination and the illegal dismantling of USAID by the U.S. government and withhold.
illegal?
And yes, it's illegal because he did the Trump administration do it
It was set up
legally.
by
Yeah.
Congress.
Yes.
The president does
president
not actually
doesn't
have the
have
power,
access
Power
to do what he did.
So I have to name it what it is.
It
You
is.
understand? So that at least, our audience understands that the president didn't have the power. The U.S. president didn't have the power, legal power to do that. But be that as it may, we have realized that we found ourselves in this particular context. We're in a space in which our health systems were significantly dependent on foreign aid.
Absolutely.
And now our governments are saying, you know what? Yeah, that was not smart. Now we're going to take the quote unquote, the bull by the horn.
Yes.
And we're going to put our money where our mouth is. In quote. Inshallah. In quote. Now, on paper, it sounds amazing. Who would not support this?
I will.
But we now need to ask ourselves, more and more, we're talking about domestic resource mobilization for health. So everyone is talking about how do we get more money into health? But then the question is, what do we use that money for?
What are we mobilizing for?
The money
Is it
for.
to control?
Are we mobilizing money to build more tertiary hospitals when majority of the people that need actual access to healthcare at the primary level in communities? Are we mobilizing more money to build infrastructure? Or are we actually investing in community health workers at the ground level that are actually meeting people where their needs are at? Are we investing in issues that the data is telling us that we need to invest in? Or are we actually just investing in areas in which majority of our population is not affected by that health issue? And then what happens to the data? How are we using the data to inform the decision and to advise the allocation of resources? But also, how are we using the existing resources efficiently? Because majority of our money actually goes out in leakages and mismanagement. And this is not only a Ghanaian problem.
It's not though.
It's a general African problem, my sister.
It's
The
not
amount
so.
of money we could save by plugging some of these loopholes and addressing some of the wastage from double procurements. And
names.
don't forget, in many countries, health is not only the responsibility of the central government. It is also cutting across your, either in some places the provinces, in some places local governments, depending on what sort of administrative infrastructure you have in your country.
Yeah.
But then you have the central government procuring this. You have the local government procuring this. The same things. Then you have a hospital that has maybe like 5 or 6, incubators, and another one has nothing. And then you're asking yourself, how are we actually using and making wise investments into our health system driven by evidence and data and making sure we're truly meeting the needs of the population?
Not acting like.
Not acting like. So we appreciate the idea of this Accra reset. Honestly, I think on a global stage, the principle is right. But the devil, they say, is in what? Is
The
in
details.
Is in the details. And then we need to ask ourselves the question, in all these things that we're doing, who is being left out? Who's not receiving the services they need? How is the Accra reset delivering for people living with disabilities? Who we know right now will not have access to services because many of the facilities are not set up for people with disabilities, for example, to be able to walk in. So what happens to who are the people that are, quote unquote, the most marginalized, the criminalized, that will not have access because we've decided to take a very umbrella approach to everything? That's not sovereignty.
That's not
Yeah.
sovereignty.
That's not sovereignty, because if your sovereignty is as good as the weakest being covered, and the moment the weakest, the most marginalized is not being covered, you've not delivered a sovereignty that is people-centered.
I'm going to come back to Ayesha. You've worked extensively on women's rights, democracy, and development across Africa. How do patriarchy and gender inequality continue to shape whose freedom and dignity whose freedom and dignity are prioritized within African societies?
I think it's very clear that it's the freedom and dignity and privileges of elite men that are most prioritized. Because if not, there would be more attention paid, say, to gender-based violence. Here in Ghana, 1 in 3 women have experienced gender-based violence. No, not even gender-based violence. Domestic violence. Therefore, violence within the confines of their own home and family. And the number is higher if you look at gender-based violence, stranger violence, state violence in general. So if we had a prioritization that included women, first of all, there would be a reduction in gender-based violence, which would mean both bringing up men and boys to construct their manhood, their masculinity, in ways that doesn't only allow emotions of rage and hate and express it in violent ways and aggressive ways, and to recognize the right of all human beings, women, girls, boys, men, everybody, to be free from violence. But secondly, in the event that it happened, there would be serious sanctions. Rape within marriage would be recognized as a crime in every space in Africa. There would be funding for shelters. There would be protections, monetary and physical, for women and children forced to leave their homes because of violence. There would be a sense that we used to be able to say it takes a village to bring up a child, but there would be a sense that the whole village is looking out for everybody's security, so that women would not be afraid to walk around in the streets. If we were prioritizing women and girls and poor people, education, politics would not be a rich man's game. We know that politics is a rich man's game, not only in Africa, but including in Africa. Okay. There's things like the whole system of party patronage that we have. You have man, no man, as we say in Nigeria. Okay? So you have to be in the good side of some man who already has power and privilege and suck up to them before you can get a place.
Yeah.
Okay. Which militates against women being able to represent their community.
Yeah.
Which militates against poor rural people being able to represent their community. If we prioritize people in general, that wouldn't be happening. We wouldn't have, for example, parliaments that meet very, very late at night when, in the current gender division of labour, most women are worrying about their children, even when they're elite women who have servants. Yeah? We wouldn't have the situation where we think that the problem is in the people who haven't had schooling, or the people who haven't had or the people who are women. So we have to give them capacity building and training because the problem is in them. The problem is not in them. It's in a structure that doesn't take account of their needs and their realities. If we had a situation in which the categories of people being prioritized included women, we would have ratified across the continent the Maputo Declaration on the Rights of African Women right now. And so we would have 50% of every parliament, local government, etc., being men, and 50% being women, because that's how we roll, my friends. So we have to have everybody represented. And we also would not be subjecting our children, as I gather that they do in Ghanaian schools, but probably elsewhere as well, with asking them at primary school, who is the head of the household, and marking it wrong when a child says, my mother, or my mother and father share it, or my grandmother, or my grandfather, because actually the households in Africa vary tremendously. They are not all the Western ideal, which is actually not even true of the West, but certainly in Africa, they are not all the Western idea of a father, a mother, and 2.2 children. We have households that are multiple sisters and brothers living together with their children. We have households that are grandparents with grandchildren.
Cousins.
We have households that are cousins.
Yeah.
We have households that are where the woman is the sole breadwinner. You can't bring up children to say this is what a household should look like if you recognize all categories of people and prioritize everybody. I can go on.
Am I prepared to play the devil's advocate where I say that maybe the structure of family is that they're communicating or the teaching these children is, based on the Bible? So
But is it based on the current realities in our context? Because
reality is should I say what I want to say?
it's not
Do
subjective.
you want to say it's subjective?
I want to say it, but I also want to not say it.
No, but my
Because
see,
two things could be true, right?
Yeah.
That's the actual structure of a home should be that a man is the head and then everything else follows. And then there's the fact that a woman is leading the home but then gives reference to the man as the leader of the home.
Can I ask
But
you a
who
question?
says that
Yes.
a man should
be the head of the household?
Who has the right to define that for everybody else in the world?
I guess because I didn't prepare for this question, I don't have a
Can I?
But I'm just going to say that. Because I believe that right now in the world, a lot of women are leading homes. A lot of women are providing for homes. But then again, when you look at it, do you really want to be addressed as the head of the house? I mean, I don't think, I think in my mind, I'm like, if you're really busy doing what a woman is supposed to be doing, being a mother, nurturer, bringing up a home, just doing your thing, then I don't think being the head of the home is debatable. So we just leave it to the men and move on and follow what
I mean, there's two things in that. First of all, the idea that head of the household should only be for one gender means that you're giving to the notion of head of a household some kind of power and authority.
You set a hierarchy.
A
And then
hierarchy.
you
It comes with
reinforce
responsibility
it.
as well.
Hierarchy.
Yes,
It
but
comes with
you
responsibility.
reinforce it.
But women, as well as men, have also had responsibilities. They've not always had the possibility of exercising that responsibility outside of a household structure, but they've always, nobody has ever said, nah, women are not responsible for their children. If your child is not getting food, you don't worry about who's the household head, you get the food.
Yeah.
Yeah? The second thing is, you keep saying should. It's that should that worries me. Because who defines the should? Who has the right to say the household, the family must only be this way to be correct, and everything else that people actually do and take pleasure in and exercise their rights in is wrong?
Yes.
Who has the right to say that?
And I take you back
I
to...
promise you I'm going to do the research and then give you
You know, and it
promise you
also
that.
takes you back to Dr. Moses' question on what our values are as Africans, right? Because if you're saying should and it's rooted in the Bible, immediately you have negated your own conversation.
Oh,
because,
okay,
you know?
okay. So once you're bringing that in, even though I'm ready with your question, let's just stay on this just a little bit.
No problem.
Reaction team, pardon me, just a little bit. So when I say culture, when I say the Bible, then that was like you would rightly say the low hanging fruit. But then let's talk about culture. The African culture acknowledges the.
But
and then
it's not
Ayesha
a hierarchy.
Yes,
Yes, because she's not
all
only
sitting in our seats.
Yes,
We're all sitting in our seats right now.
We're trying to be. We're trying to be good guests.
Please,
But you have to consider that the structure of the family is also very dependent on where you live and your environment and where you come from. And so, for instance, the same way that we say that when you name gender, you reinforce it by naming family as a specific type of family, you are reinforcing that. So by saying that there should be a head of the family, you've already designated that somebody in the house has to be the head, and that person has to have the power over everybody else in the house, as opposed to what we are saying is they are equal in the household.
We'll have
And even if-
differentiated responsibilities.
Thank you.
Maybe.
Sometimes.
Let's just.
But
Also, you want to add, you want to wade into this conversation, or you leave it alone?
So I always ask people, how do you want to bring up your daughter? Totally disempowered, not to lead the home. I think for me that would be a wrong approach. If you really put the question to yourself and say, how do I want to bring up my daughter? I think you'll question the traditional definition.
I love this. I love this. Okay, now the
let me also-
case is closed. Actually, you want to know it's not closed yet?
because the phrase that was mentioned was the African traditional family. We have many cultures in Africa. We have many different forms of family. So to say that reduces us to one particular version of it. And I'm sorry, that version of it corresponds very largely to 19th century middle-class England. And not to
My
what's
production
actually
team
in
is telling
Africa.
me that this conversation I'm getting into is not part of my questions.
We need to have a part two.
I need to stay away from this conversation. Please, I'm moving on. And I'm coming back to you, Takyiwaa. Many young Africans are deeply frustrated with governance systems, but still hopeful about the future. What gives you hope when you think about the next generation shaping Africa differently?
Oh, conversations like this. You know, I think earlier on I said that we are building our work, we are building our movement on the work of older feminists. Right? You know, I know I keep saying older, but I am actually quite old, I would like to believe. I'm as old as it gets now. I'm hardly the youngest person in the room these days, so I love that for me. Okay. But it's also because I'm watching the art scene, the creative scene, I'm watching the conversations we're having on social media, I'm watching the conversations we're having on TV, and there is different voices. Growing up, we didn't have that luxury. You only saw one type of person on TV, you only heard one type of narrative. We have not just the availability of different voices, but accessibility. And so you can actually find different voices, you can actually find information. And that gives me a lot of hope, because it says to me that as it stands right now, we are confident that the world is capable of change, and we haven't lost hope yet. Because losing hope says that we don't think the world will change, and that's not true. We are very capable of imagining a very different world, and the world that we imagine, the feminist future that we see, is very. I want to say we are surviving, but we're also thriving. We're not just living from the day to day, and that gives me hope. When I see what is being created, when I see the conversations being had, it gives me hope. When I see MX24, it gives me hope, because you wouldn't typically see youth-focused, youth-led platforms, but then now we have a whole TV station just dedicated to that, and that alone gives me hope. But also, I'm a very optimistic person, so don't quote me.
Now, Moses, coming to you, many Africans experience healthcare inequality through class, geography, gender, or economic exclusion. How do we, I'm going to leave it to you alone, how do we ensure health systems become more people-centered rather than privilege-centered? Who made that? You made.
I think we need to recognize that our health systems have had historical injustices. In Ghana, the first hospital, 1878, the Gold Coast Hospital. I don't know if it's famous here, but it was to treat colonialists and those that served them. It's much later that an indigenous hospital for indigenous people was constructed. This is how our insurance systems have been constructed all over. Insurances for those who are working. In my country, we still struggle with ensuring that the community insurance is actually run. I think it takes us back to recognize these historical injustices and we fix them. And I love the fact that even at the highest level, people are pushing back. In Kenya, when the government of the US said we are going to give you $13 million to establish a safe haven for people who have Ebola not to come to the US, they sued, and there has been challenge on that. When the US government came and said the new money that is replacing USAID in many African countries is going to be, you're going to receive it after extraction of your data. Countries have opposed that.
Yeah.
I think this never happened in the colonial times.
Yes.
It gives a sense of hope that Africans can actually push back. So what we need to do is to go back to the roots. Many African countries have built health systems that have community-centered, health unit management committees, which are part of hospitals and service delivery. I think we need to re-empower those, but also do pushback on what is reinforcing injustices.
Lovely,
Yeah.
lovely. Kemi, you work extensively in digital advocacy and storytelling. Why is narrative so important in shaping how Africans understand justice, gender, health, and social change today?
So I think it's extremely important to realize that, the way we see the world is shaped by the things we hear and the way we interact with ideas, with knowledge, and it's not just informed by just our own individual perceptions on things. And we've seen people taking note of that and trying to use that to be able to influence people, to influence the things they prioritize, to influence the issues they want to work on, et cetera, et cetera. And even as we're talking about, for example, this issue of sovereignty, everybody has framed it in the space of it is us against the West. We want to fight the colonial power. It is our, but without necessarily even framing it, even also again from the perspective of it is about what we want for us and what future we see for ourselves now, but also for the future generations to come. What is that shared vision that we want? And I think that it's extremely important. We cannot actually influence those narratives without understanding where we're coming from. And I think really understanding, if you notice, Dr. Ayesha and Moses had really even made references to understanding and unpacking some of the historical injustices in terms of seeing the way the world is right now. It didn't just manifest overnight. All the problems we're seeing didn't just wake up one day and just happen to us. They were baked into the systems and the structures in which we operate. And even though, yes, we gained independence and all of us celebrate every year, we never undid those systems.
Yeah.
We never took it apart and saying, oh, as Moses was saying, there's hierarchy in terms of who has access to health based on economic ability, right? Or, for example, as Dr. Ayesha was saying, oh, there's hierarchy even within the home. You understand? And how does that hierarchy affect
your
power?
access to health.
And how does the power affect access? You understand? So, to be honest with you, we really need to spend a bit of time unpacking those things, because it's, in a way, sometimes some of these narratives, and we've seen, of course, there are a lot of people that are using different, influencers now, the media, and having conversations, but we're not really helping people to be able to really think critically and to be able to say, you know what? My everyday life is not just shaped by my own individual experience, or it's not just shaped because I am born a woman or because I am born in a particular Akosombo, for example. No, it's not. It's shaped by those systems and structures that interact with all of those things. So if we're even talking about in terms of even access to healthcare or access to education, the location you live dictates what kind of resources you get. You understand? What access to services you get. So we really need to help in terms of the narrative. It's part of what I'm calling political education. You understand? That we need to actually do with young people, to be able to understand that some of these policies they're seeing, to be able to understand that, and the policies giving right to either access to services, education, health, livelihoods, economic opportunities, they have to unpack what it is, because that's the way we can be able to engage with our governments, who are, as far as I'm concerned, they're custodians on our behalf. Yes. They're custodians on our behalf, right? And to be able to hold them accountable, to be able to say, you know what, this is what the expectation is. If you said, yes, you're going to invest more money in this and that, no problem, but we want to see results.
Yeah.
We want to see results. It's the social contract we have with you.
We have. Wow. I told them that 1 hour is not enough for my ladies, but they did not listen. They didn't at all. Well, before we go, we'd like to definitely hear from Ayesha before I wrap up this entire conversation. And whilst you were talking, I think one of the things that kept coming to me would be this conversation on reparatory justice. The education, even on that. It's left hanging, and we're just here. Again, we're not unpacking, and like you're saying, so I'm just tying into what you're saying. We're not unpacking what it means to even go into these conversations as Ghanaians or as Africans. And so we're wading into these wars, we're wading into these conversations without fully understanding what it truly means to even be a part of these conversations. And so 1 hour is still not enough. But there are growing tensions globally around, and this one, when Ayesha is done, we can take a bite and then we'll wrap up the conversation. There are growing tensions globally and around, that is around culture, identity, religion, and right. How can African societies navigate these conversations without reproducing exclusion, fear, or injustice in the name of African values?
That's a lovely question and a wonderful project.
Great thesis topic.
Powerful project.
27-page paper.
By assuring the right of all of us, every single African man, woman, and child, to recover the historical traces that led us to where we are, and some of the which got dropped along the way, but also to what I call curate and co-create the ongoing and living culture. That is to say, to be able to participate in defining what are the elements of our past culture or history or spiritualism that we think we should be going forward with, that give us all space and empowerment, and what things might we want to leave out so we can help in defining, and what things do we want to create because we can see a space for them that we need. And the reason that this is important is because cultures are living things. We talk about, and they're living things and they're diverse things. And they're diverse, they're living in the way that no culture is ever going to be exactly the same as it was even 10 years ago, never mind 100 years ago, never mind the thousands of years of African history that we've had. Because when people talk about the African culture, they're assuming that we have not had historical change in thousands of years, which obviously is not true when you think about it. But secondly, cultures are diverse in that they're diverse from place to place, from historical time to historical time. That's why we can sit and talk about what's the difference between the Hausa culture I grew up in and the Yoruba culture that Kemi grew up in, and the Chui culture that Pamela grew up in.
Yeah.
Okay, we have similarities, obviously, because we're all in Africa and there are some material realities that are the same, but there are differences too. But there are also differences within a culture. My experience of culture as a woman is not necessarily the same as my brother's experience of culture.
Yes.
Even though you're from the same.
Even though we're in the same household, never mind the same culture. Okay, he's allowed in patriarchal culture to do things I was not allowed to do. I had responsibilities that in patriarchal culture, growing up as a girl, he did not have. Okay, nobody goes, girls will be girls, they can go out and play. Boys will be boys, they can go out and play. Okay, so that we have to be able to say, let's look at those aspects of culture and say, is that a value we want to continue? Do we want to continue discriminating against people who are not exactly like us? Maybe they're not the same ethnic group, who are not exactly the same religion, who are not the same gender, or do we want to give chances and space to everybody? So let's draw back on the history and see where that's possible. For example, let's talk about bodily autonomy, control of one's own body, for women or for men. But it's most often mobilized against women in the name of Christianity or Islam or traditional African women to control women's bodies. But if you look back in the history, in very many socioeconomic formations in Africa, there were wise women, there were herb women, there were women that we now call witch doctors, who helped women control their own fertility. Yeah. Had herbs to enable women to control their menstrual cycles, their pregnancies, and so on. If we look back in early Islam, there were discourses, both from the Prophet and from the people that we describe as judges and scholars, that valorized women's rights to dispose of an abortion, including for reasons that we would call as frivolous as not wanting to spoil her figure. Yeah. Okay? So when people turn around and tell me as a Muslim woman or a woman from a Muslim community that Islam does not permit, I say, yeah, go back and look at your history and the theological writings and texts, because there were discussions that precisely did allow that. Okay? And without anybody else's permission except the woman over her own body. Similarly, I have friends in the Christian communities who look back at the history of early Christianity and the writings, the ones that do not follow the tradition of St. Paul, I have to say, the ones that follow the traditions of Mary and so on, that again, give women rights of control over their bodies. So the question is not religion doesn't allow it, but whose interpretation of the religion are you going to follow? And why should you tell me that I must follow your interpretation and not the one that I think is correct and free? So that's why you have to insist on the rights of people to participate in recuperating history, because it's powerful when I can say to people in the Muslim community, no, that's not correct history. Go back and look. You can see. Okay? It's not just my word. There's proof. They wrote it down. Okay? But it's also powerful when we can say, but the Prophet also said women and men should be protecting friends one of the other. So we can move on and say, how in today's world can we protect each other? Okay? And there are similar examples in Christianity, which, not being a Christian, I hesitate to say loud, but I'm sure other people will. So, again, let's take another very thorny subject, the issue of queer culture, or lesbian, gay, bisexual, transsexual, intersex. What's the other one? Asexual.
Yes.
And the asterisk for the ones we haven't yet discovered or don't know about.
Right.
Which very many, in particular, US Christian evangelical groups are bringing to different countries in Africa, to Ghana, to Uganda, to Nigeria, and saying, Christianity says this about queer culture. First of all, within Christianity, there are lots of different interpretations. That's not the only one. Second of all, we can't really turn around and say, hey, that is authentic African culture, when we can see very clearly where it's been coming from, who is funding it. But thirdly, it ignores the actual situation in Africa, where we've had many, and continue to have, many different ways of understanding gender and sexualities. We have communities that have female husbands. We have communities with male mothers. We have communities that in Hausa we call it Endaudu, which encompasses transsexuals, cross-dressers, bisexual, and so on. And they were all part of African social formations long before the colonialists came to our shores. So if we're going to revert to our African cultures, please let's go to the real African cultures that actually existed, and not somebody else's version of what it is, and then they bring lots of money and talk to lots of people and think, yeah, then we take it as if we were idiots.
I told you so. You people, I told you were not ready for this conversation. But it does not end in this room, ladies and gentlemen. It does not end in this room. We will continue to do all the incredible works we've been doing all these years to make sure that when we touch on the conversation of African sovereignty, there is art, there is medicine, there's healthcare, there is leadership. All of these aspects of African sovereignty are like clearly defined and communicated effectively. Thank you so much, ladies.
Thank you,
Thank
Miriam.
Thank you for joining me. I think there's a part 2, right?
Yes.
There has to be.
There's a part 2 of this. But thank you so much. And this has been a wonderful gentleman on the panel. I have enjoyed thoroughly your conversations. Trust me. Anytime I meet men in a room with women, I'm always very... But thank you so much for being such
Thank
a
you so
gentleman.
much.
So today our conversation has been on what should African sovereignty mean today, and the ladies and gentlemen in the room have done their best to break it down in different aspects and facets of leadership, of running the African continent. And so I hope you've learned a thing or two, and I hope we will continue pushing the agenda of African sovereignty. This is a special edition, and thank you. Like I said, there's going to be a part 2.
Thank you for having us.
Who advice?
Thank you for having us.
Ayesha, Imam, and Pamela, Takyiwaa, Moses, Mulumba, Fadekemi, a.k.a. Kemi, join me on my couch, and it has been a wonderful, wonderful conversation.
It has.
Good one.
Thank you for having
and
us.
we're going to do this again.
Yes,
Okay,
Hopefully by the time
we'll get ready.
we'll get ready
Yes.
for part 2 of this. Have a good one.